Hi.
Hi.
My name's Denise. I'm going to be your nurse today. Can you tell me your name?
Tyler.
All right. And how old are you, Tyler?
16.
All right. I understand you're in for a cardiac and a peripheral vascular assessment. Do you have any questions before we get started?
Amen.
Just to let you know, there's going to be a lot of touching and a lot of different areas and a lot of listening to areas. It doesn't mean anything's wrong. We're just going to do a thorough assessment for you, okay?
Yes,
All
ma'am.
right, good. Now, do my hands right quick. Excellent. Okay, I'm going to first start off with your upper extremities. I'm going to be looking at your arms. I'm looking to make sure that they are symmetrical. I am looking at all of your hair distribution, which is nice and even. I'm going to check your skin turgor, which bounces back nicely. Excellent. And your skin is nice and warm and dry to the touch. All right, now I'm going to go on and palpate your pulses. This is your radial pulse. And these are your brachial pulses. Excellent. Okay, Tyler, you can put your arms down for me. I'm going to move on to your neck, which is where your carotid arteries are at. First thing I'm going to do is inspect. I'm just looking for lumps, bumps, bruises, or any pulsations. I do not notice any. I'm going to go on and palpate your carotid arteries one at a time. We do not want to cut off any blood circulation for you. Excellent. And on this side? Very good. Okay, now we're going to go on and listen to those. Okay, we're going to be listening with the bell, which is the small side. I need you to take a big, deep breath, blow it out, and hold it. Blow it out and hold it. Great. We're going to listen to those three areas for you. Good. Breathe. All right, now we're going to do this side. Same thing, and hold it. Excellent. Okay, you can breathe now. All right, now we're going to go on and move on down to your heart. After I check your hand grip, we're going to go on and check that for you. Can you squeeze my fingers? Excellent. Very good. Okay, now we're going to move to your heart, okay? I'm also going to be doing quite a bit of education for you, just so you know where all of those valves are at. We're going to go on and start off with the diaphragm of my stethoscope. So we're going to go second intercostal space on the right side for your aortic. We're going to move straight across to the second intercostal space for the pulmonic. The third intercostal space, left sternal border for your Erb's point. Fourth intercostal space, left sternal border for your tricuspid. And midclavicular line, fifth intercostal space for the mitral. Okay? Very good. Now we're going to move and listen with the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Excellent. All right, Tyler, you want to lay down for me, please, sir? Excellent. Okay. Now I'm going to go in and assess your neck area for jugular vein distension. So if you'll look all the way toward me. Excellent. None there. Look toward the other side and none there. Excellent. You can look straight for me. Now I'm going to go in and inspect the pericardium, which is the area that surrounds your heart. I'm just looking for any bumps, lumps, bruises, or pulsations, and I don't notice any. Okay. Now I'm going to go in and palpate those same areas. The aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. And also on the mitral is the apical pulse. Very good. All right, now we're going to go on and listen to those areas for you. Starting with the diaphragm, the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. Now we're going to listen with the bell side, aortic, pulmonic, Erb's point, tricuspid, and your mitral. All right, Tyler, I'm going to need you to come on over and roll over on your left side for me. This is your left lateral at the fifth intercostal space, midclavicular line, which is also the mitral. All right, you can roll back over for me. Great. All right, Tyler, we're going to go on and start at your lower extremities. First of all, I'm just going to look and make sure that they are nice and symmetrical. I'm looking at your hair distribution. It is nice and even. I don't notice any varicose veins on either leg. I do not palpate any edema on either one of your legs. And your skin is nice and warm and dry to the touch. Okay, now I'm going to go on and palpate your pulses. your femoral pulse, which is right here at the groin area. We're going to move down underneath your knee for the popliteal. Then we're going to go inside your ankles for the posterior tibial. And then at the very top of your foot, we're going to do the dorsalis pedis. All right, excellent. All right, Tyler, you can set up for me. Excellent. All right, that concludes your assessment. Do you have any questions for me?
No, ma'am.
All right, excellent. Thank you.
Thank you.
Okay, I'm going to give a report on a 15-year-old male who came in for a cardiac and peripheral vascular assessment. We started off with his upper extremities. Bilateral arms were symmetrical with good hair distribution, warm and dry to touch with turgor bouncing back appropriately for his age. Radial and brachial pulses were palpated equally bilaterally. We moved to his carotids. We inspected them. There was no lumps, bumps, bruises, or pulsations noted. Palpated one at a time, but they were equal and bilaterally. Listened without any murmurs or thrills noted. Went back and did his hand grip, and it was equally bilaterally. We listened to his heart sitting with the diaphragm and the bell with good education noted to patient for area and location of each valve. We did this sitting and we did it lying, both with S3 and S4 noted, no murmurs or thrills noted. We assessed for jugular vein distension without any distension noted. Pericorneum was inspected for lumps, bumps, bruises, or pulsations. None were noted. Palpated all areas of the heart without any tenderness nor any pulsations noted. We did the apical pulse at the fifth intercostal space at the midclavicular line. We also did his left lateral at the midclavicular line at the mitral valve at the fifth intercostal space. We moved down to his lower extremities. Bilateral legs were symmetrical, equal hair distribution bilaterally, no varicose veins noted. Skin was warm and dry to touch bilaterally, and no edema palpated on either lower extremity. Femoral, popliteal, posterior tibial, and dorsalis pedis all palpated without and they were equal and bilaterally.